If sex hurts, it's time to get help. And if that's you, you've come to the right place to find some of that help. I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy, or HRT. Hundreds of hormone doctors trust me to teach their patients about hormones that aren't too high and they're not too low, but they're just right. Have you experienced any of these symptoms after going through menopause? Vaginal dryness, burning, itching, pain, or even bleeding during or after intercourse. Maybe sex is so uncomfortable you might rather just avoid it. These are some of the symptoms of what's called the genitourinary syndrome of menopause, or GSM. It used to be called vulvar and vaginal atrophy, or VVF, but doctors' groups changed that name to GSM because it covers urinary tract symptoms in addition to vaginal symptoms. The symptoms of GSM can be divided into three general categories. The first is genital symptoms: vaginal dryness, irritation, itching, and vaginal burning. The second is urinary symptoms: painful urination, urgency, you feel like peeing is always an emergency, leakage when you cough or laugh, recurrent urinary tract infections, incontinence, maybe even needing some sort of pads for protection. And then the third category is sexual symptoms. Dyspareunia is a name for painful sex, decreased lubrication, bleeding after sex. GSM is more common in menopause than hot flashes are. At the low end, vaginal dryness, painful sex, and other GSM symptoms are a problem for 40 to 54% of women in menopause. Some studies show GSM is closer to 80% of women in menopause. Sadly, women are often embarrassed or they're hesitant to talk with their doctors about these very intimate issues. So many women go untreated for years, maybe even decades. A study called Empower from 2017 asked 1,858 women, 45 to 90, about their menopause symptoms. 24% had hot flashes, but 34% had vaginal dryness issues. In that survey, 55% of women rated their dyspareunia, or painful sex, as moderate or severe. 72% of those women never talked about these issues with their doctor. They just think of them as normal parts of aging. If you just leave GSM alone, it doesn't get better. Some studies have shown that hot flashes and night sweats might last 7 to 10, maybe even as long as 12 years after you go into menopause. But at some point, hot flashes do tend to start going away. The vaginal and urinary symptoms of menopause don't go away. In fact, they often get worse. The most extreme cases are quite heartbreaking. You don't hear much about these because they're probably embarrassing, but there's something called vaginal or uterine prolapse. I would recommend that you not Google that. Take my word for it. It's basically where your female parts collapse and sometimes end up outside your body. It's not good. What is good, though, is that there are effective treatments for GSM. Treatments like vaginal moisturizers and vaginal lubricants can relieve the severe dryness and painful sex. There's something called laser ablation. There's one called the Mona Lisa touch that rejuvenates the vaginal tissue and helps with some of those symptoms. There are some non-hormone drug treatments that can help, especially with urinary incontinence issues. But unless you address the root problem in menopause, you're never really going to be free of all those vaginal and urinary symptoms. Just like with hot flashes, weight gain, insomnia, and all the other menopause symptoms, the root problem with vaginal and urinary menopause symptoms is the loss of hormones, primarily estradiol in the vaginal area. The best news of all is that vaginal forms of estradiol and some other hormones can completely reverse the GSM syndrome of menopause and renew those tissues to their proper function. I'm going to be posting a couple more videos about some specific hormonal treatments for GSM in the next couple of weeks. As the hormone pharmacist, I help women in menopause answer one simple question: is HRT right for my menopause symptoms or not? I've created a clear, concise digital course that helps you make your HRT decision in about 2 hours, more or less. It's called the Menopause Solution. For more information about the Menopause Solution course, visit my website at simplehormones.com/decision. If you found this video helpful at all, click the like and subscribe buttons. You might also want to ding that little bell to make sure you get notified anytime I post a new video. Thanks so much for watching, and I look forward to talking to you again next time.